So in this next video session, what we will address is general principles for what to do if you have diabetes and you get sick. Illness, such as, let's say, a pneumonia or a viral flu, or even simply a cold, can actually make you more resistant to insulin and can cause the blood sugars to go up. Because of that fact, some basic guidelines for you to follow is that when you are sick, you need to monitor your blood sugars a lot more often than when you're not sick. Somewhere between every 2 to at least every 4 hours. And what you want to do is you want to stay in really close contact with whoever your diabetes professional is, okay? Especially if your blood sugars are going above 20. You should call your family doctor, your endocrinologist, or if you can't reach them, the endocrinologist on call. Some general principles to follow is that when you're sick, you need to hydrate better. Ways to hydrate is through drinking water, or things like diet ginger ale, for example, which still can soothe your throat because it has the bubbles, but it doesn't have sugar in the fluid itself. As a general rule, you want to drink enough so that you're going and urinating frequently, and when you look at your urine, it's nice and dilute. Some general principles to follow is to drink between half a liter and a liter of fluids per hour. So the key messages of managing diabetes when you're sick is to check your blood sugars more often, hydrate well, and to stay in close contact with your diabetes professional. Managing diabetes when you're sick can be particularly challenging for patients who have type 1 diabetes. As you know, when you're sick, your body becomes more insulin resistant. And so it's often the case that when you become sick, even if it's vomiting and diarrhea and you're not eating anything, your body can still require more insulin than you're used to. During times of illness, if you're not getting enough insulin, your body can start to use fat as an alternative fuel source, and the byproduct of fat burning for fuel is ketones. Ketones are a form of acid, and they can make you feel really sick. The signs of diabetic ketoacidosis is rising blood sugars, elevated ketones in your urine, abdominal pain, vomiting, and trouble breathing, because as the ketones accumulate in your blood, your body will try to excrete them through your lungs. So rapid, shallow breathing is a very bad sign to suggest ketoacidosis. One of the best things that you can do to prevent going into ketoacidosis when you're sick is to continue taking your basal insulin. So people often get scared about taking their basal insulin if they have vomiting or diarrhea, but don't worry, you should take it because your blood sugars, if anything, are more likely to rise than they are to fall. And if you don't take your basal insulin, you can get into a lot of trouble with diabetic ketoacidosis. One thing to keep in mind is that you want to check your blood sugars really, really often when you're sick, whether that's with a pneumonia and you have a fever, strep throat, or a viral illness that gives you vomiting and diarrhea. And you want to compensate for the increased demands of your body for insulin by following the 5, 10, 15, and 20 rule. In order to follow the 5, 10, 15, and 20 rule, you will need what's called Keto Sticks. These Keto Sticks are good for 6 months, so make sure you always have a current supply on hand. Write down the date that they're first opened so that you make sure that they're not expired when you need them. You should check for ketones when your blood sugar is above 15 if you're sick. What you do is you urinate on the end of the stick, let it dry, and then you use this helpful little table across here, and you line up the colors to see if your ketones are negative, trace, small, moderate, or large. Once you have the ketone information and your blood sugar information, you can follow the rule of 5, 10, 15, and 20. This tells you how much extra insulin you take just to bring down the blood sugars. So for example, let's say your blood sugar was 18 and you checked your urine ketones and they were medium. You would give yourself 10% extra of your total daily dose of insulin. When I say total daily dose, I mean all the basal and all the bolus insulin you take. So for example, if you take 20 units of long-acting insulin per day, and then 5 units of a rapid-acting insulin at breakfast, 7 units at lunch, and 8 units at dinner, your total daily dose of insulin is 40 units. To help combat the high blood sugars and the ketones, you will take 10% of 40. So you will take an extra 4 units of the rapid-acting insulin to try and bring the blood sugars down. If you're feeling well enough to have a meal, so let's say you check your urine ketones and they're medium and your blood sugar is 18 and you're about to have lunch, if for lunch you normally take 7 units of insulin, you can take 7 units plus that additional 4 units to compensate for the ketones. If you're not feeling well enough to eat, you will just take the 10% or the 4 extra units of insulin. And you want to repeat checking the blood sugars, repeat checking the ketones every 2 to 4 hours. If you take 2 to 3 corrections of the rapid-acting insulin and your ketones remain medium or large and your blood sugars are not coming down, go to the hospital. Remember to keep in close contact with your diabetes professional when you're sick and you need any advice about how to do this. They can be a very good resource for you. I hope that's helpful, and please refer to this video when and if you become ill.